This video is made to teach you regarding the various scopes which are used in ENT. This video is made under the guidance of Dr. Tarun Ojha sir, Professor and Head, Department of ENT and Head and Neck Surgery at Mahatma Gandhi Medical College and Hospital, Jaipur. Before starting with the video, the students should be well versed with all the instruments shown in the video. After identifying the instrument, the examiner can ask you about the indications, the contraindications, and the position in which these scopes are used, and the name of the procedure for which these scopes are used. Starting with the first instrument, we have a esophagoscope. This is used to do esophagoscopy. How to differentiate between an esophagoscope and a bronchoscope? The esophagoscope has various markings on it which are absent on the bronchoscope. The indications for using an esophagoscope are: it is used to investigate the cause of dysphagia, cause of retrosternal burning, cause of hematemesis, and to find the secondary neck with unknown primary. The therapeutic uses could be: it is used for the removal of foreign body, dilatation in case of esophageal stricture, endoscopic removal of benign lesions, insertion of the Salter's or the Salter's tube, and injection of esophageal varices. The contraindications are trismus, which makes the procedure difficult, receding mandible, etc. The position of the patient should be supine with head elevated by 10 to 15 centimeter, neck flexed on the chest, and head extended at atlanto-occipital joint. Now coming to the next instrument, this is a bronchoscope. The bronchoscope has fenestra on the distal end which are absent on the esophagoscope. The bronchoscope can be used to find the cause for wheezing, hemoptysis, and unexplained cough. It is also used for the collection of bronchial secretions for culture and sensitivity test, acid-fast bacilli, and malignant cells. The therapeutic uses are: it is used for the removal of foreign bodies, removal of retained secretion or mucus plug in case of head injury, chest trauma, thoracic or abdominal surgeries, etc., and for tracheal and bronchial stenting. The position of the patient should be neck flexed on the thorax and head extended at the atlanto-occipital joint. This is also known as the barking dog position. Next, we have a rigid laryngoscope. This is a rigid laryngoscope which is used to do the rigid laryngoscopy. We have to note that these various scopes have beveled edges in order to provide a better view of the larynx. This rigid laryngoscope is used to see the hidden areas of hypopharynx such as base of tongue, vallecula, lower part of the pyriform fossa, and the hidden areas of larynx such as infrahyoid epiglottis, anterior commissure, ventricles, subglottic region. And it is also used to find the extent of growth and take a biopsy. The therapeutic uses could be removal of benign lesions, removal of foreign bodies, and dilatation of the laryngeal strictures. The contraindications for using a rigid laryngoscope could be the diseases or injuries of the cervical spine, recent coronary occlusion, moderate or marked dyspnea, etc. Now we have two more instruments, which is a suction and a punch biopsy forceps. This suction can be used with these scopes in order to provide a bloodless field after we insert the instrument and we take the biopsy from the site. This punch forceps is used to take a punch from the growth which is visualized through these scopes. Say, for example, the rigid laryngoscope. We insert the punch forceps through the rigid laryngoscope, reach the site of the growth, and take a punch from the growth and remove it again. Now coming to a 0-degree endoscope. This 0-degree endoscope is used in the cases of nasal endoscopy and ear endoscopy. This end of the instrument is the light emitting end, and the light is coming out from this end and is used to visualize the nasal and the ear cavity. Coming to the other end, this is the end where the light source is connected. This is the eyepiece where the camera is connected. After connecting the light source and the camera, we insert the endoscope in the nasal or the ear cavity to visualize.